Right. Well, however you feel about going to the dentist at UNC's School of Dentistry, patients can visit with a staff member whose only job is to ease anxiety. Grayson is a certified therapy dog who's been part of the team at UNC for the past few years. But a recent announcement from the dental board may limit her role and that of other therapy dogs when it comes to interacting with dental patients. For kids who love dogs, Grayson can make a trip to the dentist a little less stressful.
And the kids are excited to be able to pet a dog. It distracts them from the dental procedure.
When Grayson joined the UNC School of Dentistry a few years ago, the university made this video about her.
Or she might even go up on a chair.
She's not the only dental therapy dog in the Triangle. Some private practices have them, and Farley is UNC's orthodontic therapy dog.
Farley will just come over and she'll just put her head on their lap. And
Orthodontic resident Caitlin Cass is Farley's handler. She's studying animal-assisted therapy in dentistry.
They add significant enjoyment to dental offices, but they also add reduction in anxiety, which we know is a huge barrier to care.
But the role of dental therapy dogs in North Carolina is in question. According to an attorney for the state dental board, the board published a proposed amendment clarifying that only qualified service animals in accordance with the Americans with Disabilities Act would be allowed in clinical areas of dental offices. Therapy dogs are not the same as service dogs.
The dog can no longer go into the active treatment area.
Everyone is just slightly disheartened about the fact that they think that this is something that they are so proud of, and that UNC was the first dental school in the country to adopt a therapy dog to make patients and parents more comfortable.
After receiving comments about the amendment, the dental board is now expected to reconsider whether certified facility dogs like Grayson may go into clinical areas.
You wouldn't have a boa constrictor, you wouldn't have some dog off the street. You would have a dog that went through a couple years worth of training and is accustomed to working with children or adults in a dental clinical setting.
And if the board does decide to allow the certified therapy dogs like Grayson in the treatment areas, it is expected to specify exactly what training and qualifications are necessary. If it does not allow them, the dogs would have to remain in the waiting room or somewhere that the dentists aren't actually treating patients. And the board's attorney says they'll likely take up this issue at this month's meeting, Nick.
Now, you see, the dogs are important, so it'll be interesting to see what the board actually decides.
Yeah, a lot of people waiting on that decision.